Now, for those of you, and in fact, I think Cindy is on the line right now from GRMC in their marketing office. Just a note, if you could pass the word along to Dr. Hale, they can't see me on their screen because our cameras now are feeding our online system, but everything else should be able to work, and they should also be able to hear me with luck. This would be a completely different experience if you were using it at your house or your own office, but because of the peculiarities of our system here, it tries to our online video system wants to take exclusive control over the audio and the video. So we'll play around with this technology here as we get closer and closer to an interview, which will start in just a second about things like telehealth. For today, breezy, partly sunny, isolated light showers today. Winds out of the east, 20 to 25 miles an hour. Expected daytime highs today, about 87 degrees. Through Saturday night, mostly cloudy, some isolated showers. Winds east again up to about 20 miles an hour. Lows 78, highs around 87 degrees. People might be asking, well, what are we going to do about grill marks, Ray? And the answer is just go, whatever it is, go find it. Get to the beach, get to a swimming pool someplace, mind your social distance and your isolation, and go out and get your actual grill marks if you can. It's 8:13 in the morning. That's news and weather together. This is The Point.
As we stand up to coronavirus by standing back with social distancing, Bank Pacific reminds you that you can come to the bank without going to the bank. Use many of our other delivery platforms like online banking at bankpacific.com, accessing cash at our ATMs, shopping with our debit cards. For businesses, we have secure cash and check drop windows, and we are employing a new smarter mobile app with remote deposit capture in the next few weeks. We're all in this together, and together we will win. Bank Pacific. Brothers but branches, we place roots. Member FDIC.
GPSI Guam is a professional technical services company that is a registered contractor for the federal government. They are SBA approved, 8A, and Hub Zone certified, providing program and project management, administration, technical support, logistics, and commodities. Find out more about GPSI and how they can help you today. Contact GPSI if you need assistance in meeting your small business subcontracting goals at 671-477-3058. They'll be happy to assist.
I got 8:14 in the morning. That is the studio time. A couple of words here. Mentions and portions of the Ray Gibson Show being brought to you by the guys over at Subway. In fast food, there's value. Then there's fresh value from Subway. They got sliders freshly prepared for you starting at $1.99. You can't eat inside, but they'll put it in a bag so you can take it away from Subway. Make it what you want. Portions of the program also being brought to you by the folks over at Take Care. Urgent care services available from 7 in the morning until 7 o'clock every night to serve you. And they've got everything that they need to put in place to take care of you. Urgent care, adult medicine, peds, radiology, cancer center, pharmacy, and lab services. Find them in Tamuning, accepting most insurance. Again, a reminder from our friends over at FHP. Urgent care from 7 to 7. If you're going to die, go to GRMC or GMH. If you are not going to die, then go see somebody in urgent care. Make sure that the hospital resources are taken care of for people that are in very, very critical condition. 8:15, that's, what is it, news and weather together? Nah, it's just the Ray Gibson Show.
It's the Ray Gibson Show. Call now, 888-TALK. That's 888-8255.
Quarter after 8 o'clock in the morning, it's the Ray Gibson Show until it's not going to be anymore. Got a note from Guam Regional Medical City the other day, and they were talking about telehealth and telemedicine and things like that. For those of you that are watching on Facebook Live, this is kind of a primer on what this is going to look like for those of you that are going to be taking advantage of telehealth and telemedicine over at Guam Regional Medical City. It is not a brand new topic. It is not a brand new technology, but there have been recently some loosening of federal requirements and federal rules that will allow for more of this kind of thing to take place, and we'll talk about that with some of the experts that we have over at Guam Regional Medical City. First one I want to invite into the broadcast is Cindy Hansen, who's their marketing and marketing genius over at Guam Regional Medical City. How you doing, Cindy?
I'm fine. Actually, you know, Charlie's the genius. I'm just a sub-genius.
Sub-genius, yeah. If we're putting it into that level. Anyway, you sent out a presser the other day that was talking about telehealth and telemedicine. I remember when I first took a tour of Guam Regional Medical City and how it occurred to me that as I'm walking through this place that it was internet ready. It was IT capable from the word go, and there wasn't anything that could be done in that hospital that could not be observed and reviewed by somebody someplace else. And so this is just another version of that moving forward, right?
Yeah, our technology is pretty cool, and we're pretty proud of this telehealth program that we have. But these guys are really the experts. I'm just here to support them, so I couldn't tell you as much about it as these guys could.
Well, let me see if I can get into some of that. I'm going to press your button to make sure that when I push this button, you don't get disconnected. Mila Young is online. Good morning, Mila.
Good morning, Ray.
Welcome to the program. Excuse the mess. Now, you're a specialty care manager at Guam Regional Medical City, and as I'm looking at Dr. Hale over on the other side, waiting for me to bring him in, and I'm not sure. Can he hear me? Do you know?
I can hear you, Ray.
Oh, and I can hear you just fine. We've got you coming in loud and proud on the systems here. Good morning, Dr. Hale. Where exactly are you?
We're in the boardroom in GRMC. I don't usually interview patients here. I'm usually in my office, but it's a similar setup.
All right. Well, I can hear him. Can you, Real Joe? Are you bringing him in?
Yeah, he's not coming in off the Avra. He's actually
he must.
coming
Okay,
in
so he must
line.
be coming in on the phone lines that either Cindy or Mila are on right now. Well, there's a familiar face. I didn't recognize you at first because you had the mask on. But welcome back into the studios here of 93.3 The Point. And we get into the concept of telehealth and telemedicine. As I said, this is something, Doc, that's been around for a while, hasn't it?
It has been. I know I've been Skyping family back in the States for quite a few years now. We probably could have been doing telehealth for quite a few years, but we haven't. And so this has kind of forced our hand. This is the time to do it.
Absolutely. When we stop and think about what the capabilities are in other islands, other parts of Oceania and the Pacific, there will probably be somebody, a general practitioner out in one of these islands that might need some help from Guam Regional Medical City. Maybe somebody like yourself who is in urology, one of the brain surgeons, right?
Sure. You know, I actually, as you brought that up, I actually do communicate with some of the providers in Saipan, and we've used telecommunications to facilitate that.
Now, in the past, my understanding was there were concerns because you are practiced and licensed to do business here on Guam. You've got all the certification that is required to be a doctor here on Guam. One of the questions and among the concerns in past was it's like passing the bar exam and doing legal practice here on Guam. You're okay to do that here. By what means are you allowed to dispense medical advice in another territory, another state, using telehealth?
That's a good question. I mean, I see for our Saipan patients, I actually see the patients here. So I'm talking about established patients who have seen me. And then when they go back home and their provider has some questions about it, there's a change in status, they might send me an email, send me a WhatsApp, and I'll respond to them. And so we've already been using telehealth. I mean, I could speak to somebody if it's already my patient,
right?
Then there's not that problem. I can't just go over to Saipan and start seeing patients. I would need a license.
Right, to practice over there. But using telehealth and working with practitioners in Saipan, it is as though you have all of the bona fides that you need to practice medicine in Saipan or Chuk or Palau, right?
I'm not licensed in the CNMI. I believe I would have to have a license there to practice there.
Right. Well, but to practice there, but to practice telemedicine, you are authorized now to be able to do that.
That's a good question. I'm not sure if this new law that where the CMS has kind of liberalized their some of their restrictions might allow me to do that. I'm not sure.
You know, I checked yesterday, and as a matter of fact, Guam is part of a union of territories and states that have allowed for this kind of thing. So if you've got if you're part of this telehealth union, and Guam is, you are able to practice telehealth wherever somebody makes the telephone call. I guess one of the other questions that I have for you is how do you get paid for something like this? Because I know that was among a concern for a lot of people as well. How do we bring in another practitioner from someplace else and make sure that they are paid, that their bills get paid because of the telehealth? I mean, normally do you do this pro bono, or do you send an invoice to somebody?
My understanding is that the audiovisual, the telehealth sessions are built similar to a regular in-person visit.
Mm-hmm.
But that but I'm not the expert. The hospital actually gets paid. They take care of the billing for us. So I might pass that on.
Yeah, I know the people in your receivables. You're definitely getting paid. There's never going to be a question about something like that. When you get into a session like this, Dr. Hill, again, neurosurgeon at Guam Regional Medical City. When you get into a
neurologist.
I'm sorry.
Neurologist.
Oh, neurologist.
I don't cut on anything. You don't want me cutting on your brain.
That's if I recall our interview. That's right. When you get into a situation like this, telehealth, is it exactly the same as a doctor visit? I mean, you've already got the vitals in front of you. Somebody's already come and taken blood pressure and temperature and things like that. So it's the same, except you're just physically not in the same room, right?
Well, there are some limitations to telehealth. I like having a nice set of vitals when I go in to see what their blood pressure and their heart rate and temperature is. I don't necessarily get that unless they have a home blood pressure cuff, and many of my patients do. And there's just certain limitations as far as the physical exam, what we can accomplish. But yeah, I mean, especially for our follow-up patients, there's a lot that we can accomplish with a audio-visual conference with the patient.
Now, if I wanted to, Doc, could I press a button somewhere on my side of the gizmo and send you a copy of my medical records or X-rays or things like that, so that you could review those simultaneously?
Well, if you had it in say a PDF format, if you had a stack of records as a PDF, you could email it to me.
Mm-hmm.
You can't actually transfer files through our platform that I'm speaking through right now, which is called Doxy.me. A lot of times the MRIs, say from Naval Hospital, for example,
mm-hmm.
are on CD. They don't have like a portal for me to access.
Uh-huh.
If people have had imaging through Guam Radiology or FHP, then I actually do have a portal where I can go in and look at those images, which is really handy.
Yeah, I was going to say, sounds kind of fascinating. Now is what we're talking on this Doxy.me that you referred to a second ago, is this a conference program, or is this just you and I here in this call? Can I bring in, say, another GP that I've got? If I've got, I like to work with Dr. Wen over at American Medical, because he's got access. He's the one that thinks that I might have had, I don't know, some crazy disease a few years ago. Could I bring him into this conversation and you guys talk to each other?
I believe we could. There is a group chat kind of capability, but we haven't used that. Mm-hmm. Typically it's just me and the patient.
Yeah, well, I think now that people see how cool it is, I think there's going to be a whole lot more call for this, especially in these days, these times where you may not necessarily want to meet with me in person. We talk about telehealth like you're going to want to do this between here and Saipan or here and Wisconsin or something like that. There's coronavirus floating around here, and you don't necessarily want to be in the same room with me if I've got it, right?
That's true. I don't know if you have it or not, and you don't know if I have it or not.
Mm-hmm.
And so this is really crucial. This is really essential to, because when this came along, I kind of had this sense of, oh man, I've got all these patients that I need to be seeing, and what am I going to do with all these patients?
Yeah.
They need help. They need regular routine follow-ups, and we need to discuss the results of their labs and everything. So this is really beneficial and help the ball rolling. People are still getting sick. People are still having strokes, heart attacks. Those things don't slow down for the coronavirus. And I will just mention, as a kind of a public service announcement, I'll just say that if you think that you're having a stroke or a heart attack, you still need to come to the hospital. If you think it's something that's not urgent, if it's more of a sort of a chronic problem that can wait, it's probably best to wait and not come to the hospital, because this is really where sick patients are, and you might be at higher risk of contracting something. But but there are things that we can do in a certain window of time. If you're having a stroke, and that window of time could be 3 hours, it could be 4.5 hours, depending on the situation. It can even be out to 24 hours that we can actually do something like going in with a catheter to pull out a clot. I think we've talked about that with you before, Ray. Dr. Scott Shea can use the catheter. We have IV TPA, clot-busting drugs, and then the cardiologists have their tools. So if you're having an acute medical problem, heart attack, stroke, something else like that, you still need to come to the hospital. Routine things that can be taken care of over telehealth. Ask your doctor if you can have a conference. My wife actually just had a visit with her orthodontist, getting the Invisalign. And, I thought it was the coolest thing. Her orthodontist is talking to her on WhatsApp.
Yeah, no, it absolutely is. It's so that we can use the technology here in a different form and fashion. I wanted to see if I could. Mila, is that you coughing in the background? Who's the one that's coughing? Who's got coronavirus back there?
It wasn't
Cindy
her.
does.
Now we're talking with Dr. Hill from the neurologist at Guam Regional Medical City, but that's not the only thing that you can use telehealth for. In fact, my understanding is that there are from trying to remember exactly who it is. Recent authority granted in the federal government has allowed for more expanded use of telehealth in cases where we're dealing with people that have got anxiety issues, mental health issues, and things like that. So where else, Mila, in the system at GRMC can we use this telehealth, this telemedicine technology?
So like what you mentioned about CMS, that's the Center for Medicare and Medicaid Services, that has lifted the restrictions. It essentially allowed any practice to use telehealth to ensure continuity of care, and like what Dr. Hale mentioned with, say, non-COVID illness or like chronic conditions that still need to be, maintained. And aside from neurology, we are planning to adopt it to majority of our specialty services, and like cardiology and pulmonary, and we're taking it one step at a time. And the only reason for that is because with less restrictions from Medicare, we're able to provide this service timely, meaning to still comply with social distancing and maintain that continuity of care with our patients. But we don't know, again, until when this waiver will be in effect. And it's something that we continue to review and see where else we could take this telehealth or this telemedicine to our practices.
Yeah, I was going to say, in which case is it going to be appropriate, and how do we? I'm trying to figure out as a patient. Now I might be presenting with one symptom or another. At which point does my doctor, my nurse practitioner, decide? All right, this is a case for so and so. He's not in the building now. He's not on Guam now. So we're going to set you up with a telemed conference.
So currently, we're limiting it to the providers that we have in our facility, and again, it's something that we can we continue to discuss or to bring to the table on the other specialists or specialties that's currently not available within our group. But again, telehealth, like what we have now, which is a video conferencing, it may not be available to all patients. I mean, patients may not have the access to it only because they're not using a smartphone, they don't have a computer at home, or they don't have a tablet, or they don't have an internet at all, or they don't have data from their phone.
Right.
So part of that telemedicine benefit from Medicare is what we call the telephone visits or the virtual check-ins. So we can still continue to provide care to our patients through the telephone visits without this video conferencing type of platform.
Mila, are you working with our Department of Public Health and Social Services to assist them in providing some of these telehealth services, either to personnel you have over at GRMC or just in general? You know, I noticed that my friend Lauren Rose is online this morning, and we were talking a little bit yesterday, and it's important that we have individuals with the bandwidth to understand what the opportunities are, what some of the requirements are going to be, and what some of the downsides of telemedicine is going to be from a perspective of a healthcare provider. Are you working with your opposite numbers in the government of Guam to help roll out more of this technology as we're dealing with this new CV-19?
Oh, so I'm glad you asked that question because I'm also part of the Guam Diabetes Control Coalition, and we had that discussion in the past couple of days on how we can reach out to our, patients with diabetes who already had, say, some problems with transportation, who from the get-go are not able to come into the hospital, and then more so those without access to this type of technology. So we're continuing to brainstorm on how we can roll this out to the community, maybe having more, partnerships with nonprofit organizations or other, GovGuam agencies to get this out, because it's not just our, yes, we're providing it now with the specialty services, but primary care can also do this.
Well, I'm excited about the technology, and I'm excited that you guys are doing it at Guam Regional Medical City. I've got a neurologist on the line. I was thinking of a different guy. When I said neurosurgeon, I was thinking of Dr. Kwase, who has been in the studio for many, many times as well. Dr. L, you come on back here one of these days, and we'll start talking again once we get past all of this about ways that we can help people out when they're having strokes, when they're having problems in their head, some of the things that you can fix. In the meantime, we're also curious as to the outcome of your wife's orthodontist visit. Did that go well? Are all the teeth in the right place?
Yes, he's doing a great job, and yes, teeth are looking great.
I'm glad to hear that. Sorry, it's the Ray Gibson Show, so you knew there was going to be some of that floating around in there. You have a terrific day. I really appreciate it. One of the things that, there might be a couple of guys that are watching the program now going, okay, will we see more things like this on the Ray Gibson Show? And the answer is, yeah. One of the things that I was concerned about was a certain amount of latency because he's not here. We're not on the same internet network, things like that. He's chugging through the systems over at Guam Regional Medical City. But you'll note that when I asked him a question, his answer was just like that, which means to me that we're working with some serious real-time technology here to be able to conference. So it doesn't sound like there's going to be any of those frustrating pauses and delays. If you're a patient working with Dr. Hale or anybody else over at GRMC, I think you're going to be impressed with the service. I know I am. Doc, thanks very much for your time here this morning. I know you guys are crazy busy at the hospital, so I'm going to let you get back to the work of saving lives. And thank you and all of the other frontline folks at GRMC and Guam Memorial and all of the urgent care places for taking such good care of people. We really are keeping you in our thoughts and prayers.
We appreciate that, Ray.
All right. 888-8255-888-TALK. Let me bring Mila in one last time and then say thank you very much to her and Cindy for putting this conference together here this morning. I was kind of curious as to what the technology was going to be like, what it would feel like on the air, because I want to be the surrogate for a patient and let you know just how easy it was. I think the only difficulty that Dr. Ale had was he cannot see me, but again, that's because of the nature of the system. So Mila, continue to do whatever it is that you guys are up to over at Guam Regional Medical City. I'd love to ask you questions about CV-19 and things like that, but I know that wasn't the gist of the call, so we'll save that for another time when you and I can play around with that topic a little bit more, okay?
Okay. Thank you, Ray.
Thank you, Cindy. Thank you, Mila. You both have a fantastic rest of the day and a great weekend. I hope your weekend is as uneventful as mine, I'm sure, is going to end up being. Doc, thanks very much for your time.